Hello guys, welcome to my third section. This is me, Dr. Ashfaq Khan, and in this section I am going to teach you the anterior view of skull bone. Let's start. What is skull? First I would like to define you what is skull. Skull is the bony framework of the head, enclosing the brain and supporting the face. The skeleton of the head. The head is the center of knowledge and understanding. Mind to get literature, great ideas through our skull. The part of helmet that cover the top of the head, we call it skull. What are suture of the skull? Suture. What is suture? Suture is the clinical suture or fibrous joint connecting the bone of the skull. To the unknowing individual, this shallow groove may look like fracture. It's look like fracture. We call it suture. We have different kind of suture in the skull. Coronal suture, sagittal suture, lambdoid suture, and squamosal suture. What is coronal suture? Coronal suture is a dense and fibrous association of the connection tissue. It's located in between the frontal and parietal bone. We call it coronal suture. Now look at sagittal suture. Sagittal suture is a dense, it's also fibrous connective tissue joint. It's joint between the two parietal bones of the skull. This is the left and the right parietal bone of the skull. We call it sagittal suture. Sagittal suture. Lambdoid sutures. Now look at here. This one is the lambdoid suture. Lambdoid suture is also a dense fibrous connective tissue joint on the posterior aspect of the skull that connect the parietal bone. It's connect the parietal bones this joint connect parietal bone to the occipital bone. With the occipital bone, it's continue with the occipito-mastoid bone. We call it lambdoid suture. Now look at there. This one is squamosal suture. Squamosal suture, it's also the part of cranial suture. Between the temporal and parietal bone. This suture is situated between the temporal and parietal bone bilaterally. It extends posteriorly, grow inferiorly to continue as the parieto-temporal suture. We call also squamosal suture. Skull. Skull usually consists of 22 bones, all except lower jaw, all primary interlocked. Look here, we have 8 bone of the cranium and 14 bone of the facial skeleton. Look at the anterior view of skull. This picture shows us the anterior view of the skull. The anterior skull consists of the facial bone, provide the bony support of the eye and structure of the face. This view of the skull is dominated by the opening of the orbit and nasal cavity. Also seen are the upper and lower jaw with their respective and beautiful teeth. Now look at the orbit area. This one, the orbit area. The orbit is the bony socket that houses the eyeball and muscle that move the eyeball or open the eye yield. The upper margin of the anterior orbit. This is the upper margin of anterior orbits is the supraorbital margin. We call it supraorbital margin. Located near the midpoint of the supraorbital margin is a small opening called supraorbital foramen. This one is the supraorbital foramen. This provides for passage of a sensory nerves. This foramen is for passage of sensory nerves to the skin of the forehead. Below the orbit is the infraorbital foramen. Here is the infraorbital foramen, which is the point of emerge of the sensory nerves that supply the anterior face below the orbit. Now look at the nasal cavity. Inside the nasal area of the skull, the nasal cavity is divided into hollows by the nasal septum. The upper portion of the nasal septum is formed by the upper portion of the nasal septum. This portion we call it perpendicular plates of ethmoid bone. We call it perpendicular plate of. This is the upper portion of the nasal septum, we call it perpendicular plateau of the ethmoid bone, and the lower portion we call it ulnar bone. This one is ulnar bone. Each side of the nasal cavity is triangular in shape, which is broad inferior space and narrow superior when looking into a nasal cavity from the front of the skull. Two bony flares are seen projecting from each lateral wall. The larger of these is inferior nasal concha. We call it inferior nasal concha, and the upper one we call it medial. Inferior concha is the medial nasal concha, which is part of the ethmoid bone. A third bony flare, also part of the ethmoid bone, is the superior nasal concha. It is much smaller and out of sight above the middle concha. The superior nasal concha is located just lateral to the perpendicular plate and the upper nasal cavity. Now we have cranial bone. We have two pair cranial bone, and unpair we have four cranial bone. Pair we have parietal bone, temporal bone, unpair frontal bone, occipital bone, sphenoid bone, and ethmoid bone. Look at study by yourself this picture. Facial bone. We have also facial bone. The facial bone of the skull form the upper and lower jaw, the nose and nasal cavity and nasal septum, and the orbit. The facial bone include 14 bone, and the pair bone we have platen, maxilla, lacrimal, nasal, inferior nasal concha, zygomatic, ulnar, and mandible. Now look at the frontal bone. This one is the frontal bone. The frontal bone may connect with the several other bone in the skull. The anterior part of the bone articulate with the nasal bone. It's articulate with the nasal bone. And prefrontal bone. The posterior part of the bone articulate with the postorbital bone. The bone define all part of the upper margin of the orbit. The frontal process articulates superiorly. This is the frontal. It superiorly articulate the frontal bone and laterally articulate with the zygomatic bone, inferiorly articulate with the maxilla, and medially articulate with frontal plus maxilla. Look at this is the orbital. Look at this orbital. It's this one is laterally the orbital surface laterally articulate with the orbital surface of zygomas. Its inferior surface the maxilla and horizontally flattened process from the bulk of the heart plate. It's medially. It's close to a nasal bone. Medially, the orbital surface articulate the frontal. It's also articulate with the frontal bone and maxilla. And interior lacrimal crest is the nasolacrimal groove. We call it also lacrimal nasolacrimal groove. Now look at the nasal bone. The nasal cavity is divided into two cavity because of septum. Septum made by which bone? Ulnar bone. It's also they are placed side by side. It's placed by side in middle and upper part of the face and their junction from the bridge and upper 1/3 of the nose. Now look at this one is ulnar bone. Ulnar bone, it is unfair bone. This bone is unfair midline bone which along the perpendicular plate of the ethmoid form and the nasal septum. The ulnar is a single facial bone that takes a form of plate and its superior border give to extension. We call it wings. This one and this one we call it wings. With the help of these wings, the ulnar attached to the inferior surface of the body of the sphenoid bone. The ulnar also articulate with the ethmoid bone, both platen bone and both maxillary bone. We call it ulnar bone. Maxillary bone. This green area shows us maxillary bone. Maxillary bone is also a shape of pyramid. Its base adjacent in the nasal cavity. cavity. Its apex begins the zygomatic process and the body consisting of the maxillary sinus. The maxilla connect with the surrounding facial structure through pore process: alveolar, frontal, zygomatic, and platen. The maxillary bone make up also over laterally nose wall. It's make over orbital cavity floor and upper jaw. Look at this one, mandible. This one is the mandible bone. The mandible is the largest bone in the human skull. It holds the lower teeth in place. It in place. It assists the mastication and forms the lower jawline. The mandible is composed of the body. It's composed of the body. This is the mandible body, and this one is the ramus. The ramus is located inferiorly in the to the maxilla. The body is horizontally curved portion and create the lower jawline. This is the mental. Look at this one. Focus on this foramen. We call it mental foramen. Mental foramen is a small foramen on the anterior surface of the mandible, typically adjacent to the root of the mandibular second premolar tooth. The mental nerves from this mental foramen pass through the mental nerves, a terminal branch of inferior alveolar nerves, and mental artery leave the mandibular canal through at this foramen. Look at this one, zygomatic bone. This one is zygomatic bone. Zygomatic bone are two facial bones that form the cheeks and the lateral wall of the orbit. They look like commonly refers to as the cheekbone of malar bone. Each zygomatic bone articulate with the temporal bone. It's articulate with the temporal bone, frontal bone, maxillary bone, and sphenoid bone. We call it zygomatic bone. We have a zygomatic foramen. Here there is one zygomatic and this side one zygomatic foramen. Zygomatic foramen is a small foramen. It's perforate the malar surface of the convex zygomatic bone near its center for the passage of the zygomatic facial nerves and vessel. Below this foramen is a slight elevation which give origin to the zygomatic. This was the zygomatic bone. That's all for today. In the next lecture, I will teach you the lateral view of skull. Thank you for watching. Bye bye.